Breast cancer is a very common disease. It's the most common cancer we diagnose in women. About 230,000 women will be diagnosed with breast cancer in this country this year. 65,000 additional women will have the non-invasive form of the disease. It's about 30% of the cancers that we treat in women. And even though it's a significant problem, we have made significant strides over the last decade or two in treating this disease and really trying to get women cured and back to their normal lives. There are several risk factors for breast cancer. The first is being a woman. Even though men do get breast cancer, it's not a significant risk. Increasing age, we see that as women age, their breast cancer risk continues to go up, and it peaks probably right around the 8th decade. And the reason that it starts to drop off is because of other competing things for mortality, such as heart disease and other causes of death. Menstrual factors have something to do with it, early onset of menses and late menopause. Genetic factors, of course, are important. Most women who are diagnosed with breast cancer don't have a family history, but having a family history can significantly increase your risk. Dietary factors are somewhat responsible, although most of it is related to probably fat content and weight. Alcohol content of the diet also has something to do with it. And we find that women who either have children late in life or who don't have any children are at increased risk. The highest risk group that we see is a woman who carries what's called a BRCA1 BRCA mutation or BRCA2 mutation. These are repair mechanism defects that are related to the breast cell, and typically these are inherited mutations. These women get breast cancer at a rate of about 200 times the general population. And this would be like Angelina Jolie, who ended up having prophylactic surgery because her risk is that high. I think there are several things available for women to do to reduce their risk of getting breast cancer. We like to use the word prevention. I wish we could say that there's some magic pill that we could give you that makes it go away completely. There are some women who are considered to be at elevated risk who are good candidates to take anti-estrogen medication. A drug called tamoxifen for premenopausal women. A drug called raloxifene or Evista for postmenopausal women has been shown to reduce the risk by about 50% in women who take those drugs for at least 5 years. We're also studying dietary factors and modulating lifestyle related to fat intake probably does have some prevention. And we're also doing a study now looking at vitamin D supplementation. There seems to be some preclinical evidence that supplementing vitamin D in the diet may help reduce the risk of developing breast cancer. I think the breast cancer research has really come pretty far in the last 10 years. We have yet to make that really big breakthrough to give something that we can really call a cure. But it's a very exciting time because we're really looking at the genetic basis of the disease and how the disease may be battled by looking at specific targets in the DNA. And it's a very exciting time, although it's becoming more complex. It's like anything else, the more you find out about it, the more complex it's becoming. Well, most women who get breast cancer are healthy women, and I think that's one of the big misconceptions about cancer is that you have to be unhealthy, or maybe there's something wrong with your immune system, but they're really some of the healthiest women that we see. And it just goes to show you that that really isn't it. It's not because you're leading an unhealthy lifestyle. It's not because your diet's poor or you're hanging out with the wrong people, or maybe even genetic factors, since most women who get breast cancer don't have family history. And that's part of the mystery as to exactly why this is happening. And that's part of our research, trying to figure this out in a little bit more detail.